Hello, everybody, and welcome to our first podcast here at North Florida Spine and Wellness. I am with our AFPA health coach, Thomas Sarratt. Thomas, how's it going today?
Oh, can't complain. Doing well. How about yourself?
Doing pretty good. What we're going to be talking today is outliving your genetics. And what that means is, I think everybody kind of thinks that a lot of people, whether they have good health or bad health, a lot of it is tied to their genetics, which, does have some truth to it. I think some people have some weaknesses that are more so than others. There's no doubt about that. However, what's really cool is what we're starting to learn about genetics is that genetics are basically just tendencies. And Thomas, you can correct me if you think I'm missing the boat on that, but more tendencies, more weaknesses really of what may or may happen. And what we're seeing in our office and practice quite a bit is that really lining up proper specific lifestyle to augment or basically try to fend off some of those negative genetics and utilize what we see a lot of times is there's actually some positive genetics as well, even with people who have the negatives. And if we leverage the positives and do some mitigation to the negatives, then we can see people can basically beat the roll of the dice there and improve their health regardless of what their genetics say.
Yeah, I think, when people talk about, outside of the health and wellness world, when they say they have bad genetics as an excuse for whatever health ailment they may or may have, that's not necessarily what we're talking about, I think. I think we're talking about more of, what is the best way to live to optimize my life based on my genetics? Like what can we do so I can live the healthiest life possible or so the client can live the healthiest life possible? There's certain things that are, undeniable when it comes to these genetic reports, and you either make the change and get better or not, but it's not really an excuse. Most people who have problematic genetics can do something about it to change without, a prescription drug or something like that.
Absolutely. And I think this is a good segue into talking about what constitutes good health. When we see, I think what over 50% of Americans have at least one chronic disease, I believe, at this point. And, what constitutes that? What is kind of underlying that? And probably the biggest buzzword I've seen that most people have seen is inflammation, right? They have chronic inflammation. And one of the things I always get asked by our patients is, well, what does that mean? What is inflammation? Where is it coming from? And it's really a loaded question. And really, I think if we take a step back and look at this from 30,000 feet, we can talk about how really all inflammation is basic metabolic dysfunction. And that leads us to what is metabolic dysfunction. And essentially, it's how your cells operate. So your cells are involved in every single activity in your body, whether it's activating your immune system, digesting food, your brain synapsing and wiring, every single thing that your body does has to have good cellular function. And so that goes into the mitochondria, that goes into how that cell works at an operational basis. And when the metabolics start dysfunctioning, then you start getting irregular cell operation. And that is essentially what leads to inflammation. Now, that can happen for an unbelievable variety of reasons, everything from toxins in our environment to the food we eat to our genetics, right? How we process those toxins, nutrient deficiencies, how we process nutrients at a genetic level. All of these things can end up impacting how our cells are operating. And so this is why when we talk about type 2 diabetes, this is probably one of the ones that's most commonly known with metabolic dysfunction because we call it metabolic syndrome before it is diabetes. And so when that is happening, that is usually, now there can be some genetics that lead you to that, but primarily that metabolic dysfunction is more just we're eating too much sugar than our cells can process. And so really the key thing we need to do. We need to make our cells healthy, and we need to make our cells operate at the optimal level. One thing I don't think a lot of people realize is that our bodies actually produce abnormal, what we would consider cancer cells all the time. But in a healthy person, what happens is these properly operating cells are able to come and destroy that cancer cell before it comes into thousands of cancer cells that make up a tumor. And so that's what we need, right? We need the cells to be able to operate at an optimal ability to then be able to do all the things we need them to do and create optimal health. So what was really helpful is knowing where those weaknesses in that metabolic function are, and that's where it ties into genetics. So what we want to dive into now is kind of give you some examples of what these genetics look like and the kind of things we're going to end up looking at when we see this type of genetic testing. So let's go ahead and dive into that a little bit. And we will go over to our first section of our genetic profile that we do. And it's going to go just over lifestyle. So things like sleep, how weight loss even ties into sleep, things with, maybe addictive type behavior. And it can be very, very helpful. So Thomas, why don't you kind of run us through, you run through these with clients and patients every day. Why don't you go ahead and give us an overview of what this section kind of tells us in the big picture and how it's useful?
Yeah, great question. So our genetic test that we use has things ordered in importance level as of what to change first. If you were to get one of these tests, you would start with lifestyle. That is by far the most influential section on your, changing your health. So sleep tendencies, that may surprise some people as to, how much sleep and how the quality of your sleep, how huge that is in how it affects your health. So that was literally number one on the lifestyle section, which is the first section. So it's extremely important, but not many people think about sleep as something that is vitally important to their health. Then, of course, it gives you tips on how you should sleep. For example, this test example that I'm looking at right now, it says consider avoiding caffeine and nicotine after 3 p.m. And, in the 100 or so of these genetic tests that I've seen, that's not the same for everybody. Some people should avoid caffeine entirely. Some people shouldn't have it after 12 p.m. This one, like I said, says 3 p.m. And then further down this lifestyle section, it's talking about smoking and people's ability to quit smoking and how easy that may be. So obviously we've known for many years that smoking is one of the worst things that you can do for your health. And there's actually genetic markers that tells you how bad it could be for you because it's not the same bad for everybody. I think everybody's known a person who's probably died from smoking, and then you've also known somebody who's smoked for 30 years and it's fine.
One thing that we always talk to patients about is that we need you to sleep. I mean, when people come in, whether it's energy issues or they're always sick or, whatever, they're, even trying to lose weight, we need them to sleep first. And if I get a patient who's like, they're having trouble falling asleep, they're not staying asleep, so they're waking up at 2 or 3 in the morning and they're wide awake, that's something that we have to address right away. And, that's when your parasympathetic nervous system is most active during sleep. So that's when your body's healing, when your body's regenerating, that's when your body's metabolizing cholesterol, believe it or not. And so it's really, really important for overall health to get that sleeping thing under control. And so you having some of this information can be really helpful. And then, even talk about, I know this test talks about smoking in particular, but I think we can probably extrapolate that out to addictive behavior in general. So even people who have issues with whether it's drinking or maybe recreational drugs or even food, sugar intake, anything that has an addictive quality to it, which is almost anything, can have these similar genetics where they're going to need more support. They might need someone to really help them make those changes as opposed to just quitting cold turkey, right? I mean, I think that's the big difference there. All right, so let's move into inflammation now. Thomas, go ahead and go in through, what are kind of the key markers you see on this inflammation part of the test?
So one of the key markers here is the omega-6 fatty acid or / arachidonic acid. So people all over the internet have talked about, these seed oils or these vegetable oils as being, some people tout it as the worst thing you could eat. Others tout it as,
That seems like a
a
big
health
thing right
food,
now. I don't know.
oversaturated
Something
fat.
I've seen somewhere.
What's that?
I said the seed oils, that seems like a big thing here somewhere. I can't remember where I've heard it.
Yeah, it is. And my personal stance on this, and it's based on things that I've seen and tests that I've actually done on myself and things like that. But there is a marker that will tell you how sensitive you are to omega-6 fatty acids. So what I've learned is that the appropriate average ratio, that we need as human beings is about 1/3 omega-6 to 2/3 omega-3. People often understand omega-3 is a healthy fat, and sometimes omega-6 is an unhealthy fat. And that's not necessarily true. We just need to eat them in the appropriate ratios. The standard American diet is about 18 to 1 in favor of omega-6 over omega-3s. So as a society, we're doing terribly with that. But there's genetic markers here that will tell you how sensitive you are to omega-6s. So, some people can, get away with eating seed oils, and some people it's going to inflame them. You'll feel it in your joints. You can feel it, physically feel it, not just gain weight out of nowhere. So that's a really important one right there. But one of the ones that I see really affect blood work the most would be saturated fat sensitivity, and that will jack up cholesterol if you have a very, a high sensitivity to saturated fat. It's a common misconception that dietary cholesterol is what raises cholesterol on your blood work. That's actually not true, best of my knowledge. It's saturated fat that does it. For example, one large egg has 70% of your RDA, recommended daily allotment of cholesterol, but who eats just one egg? I know I sure don't. But as far as the saturated fat goes, for example, I have a sensitivity to saturated fat, and I know that. So I avoid things like coconut oil, while coconut oil might be a superfood to somebody else.
Yeah, that's a great example. And even what you were talking about, the omega-6, omega-3 type of ratios, it's about balance. There's really nothing in your body. I mean, this makes kind of common sense, I think, too. There's, anything that your body makes naturally probably shouldn't be zero, right?
Right.
And, with a lot of foods, there's always these debates going back and forth. And a lot of them where people go wrong is they tend to leave out the nuance that you're talking about. And yeah, when you go to this extreme ratio of 18 to 1, yeah, that's going to be horrible inflammation. Omega 6s can have some of, actual function that they need to be there to some extent. So there needs to be that balance. But yes, we are way too high with the standard American diet. And I think it's even more of an excellent point to point out the saturated fat sensitivities. Because like you said, coconut oil is such a great example. Superfood for one person and, potentially deadly to another. So these are things that we wouldn't know unless we saw this on your genetic profile. Okay, let's move on to histamine sensitivity. This is a pretty interesting one. I think a lot of people are surprised when I tell them that there's actually foods that naturally create histamine. Essentially, what happens when people have histamine issues, and it can go into mast cell dysfunction and all kind of different inflammatory conditions, and essentially, it comes down to how you process histamine. That could be histamine from your environment that you create by exposure to certain pollens, or there's histamines that are naturally occurrent in foods. And one of the markers we see on here is DAO activity. So DAO is actually the enzyme that breaks down histamine, and that for the most part happens in your gut. And so if we have this weakness here and we see people with symptoms that line up to it, this might be where we really start to be able to personalize and customize certain foods, because there's foods that we typically think of pretty healthy. We see lots of fruits, vegetables, different things in here that were not like necessarily processed foods that are pretty high in histamine. Fermented foods are loaded with histamine. And usually we're thinking of eating fermented foods to help our gut flora, but that's not always going to be the case for everybody. Now, with this being
And how would
said,
you know that unless you ran a test or had like very obvious symptoms?
right. And the thing is too, is sometimes these are weaknesses where it's not necessarily going to play out in reality, especially if you have a balanced diet and your gut is in good shape. Because this is the other thing too. Let's say this is a weakness for you, so your DAO activity is decreased. Let's just make up that story real quick. That might make you more prone to this. But if you have a really healthy gut lining, um, then you may offset that and not have an issue at all. However, if you've got leaky gut on top of having this low DAO activity, you are much more likely to have this type of issue. And it might be more of a something you have to be a little bit more serious about. I've seen patients where we've had histamine intolerance, we treated them, we've given them DAO enzymes, and then we went through a process of actually healing their gut. And guess what? Not only did they go off the enzyme, but they were able to eat some of these foods in moderation and not have an issue. So this is a great example, I think, more so than a lot of these areas where this is, while this gives us good information, it's not necessarily set in stone how that's your body's going to play out if you make the right moves. So you can augment these quite a bit.
Right.
Okay, let's go on to food and food additives. I always think this is interesting because it's like, when I get to the food additives part, I'm like, I mean, shouldn't we just avoid this altogether? And for the most part, that's probably true. There's some food additives I would argue that are probably, well, certainly worse or more broad. Shouldn't no one should have than others. But this is probably something that you probably I don't know. Do you see some pretty consistent findings on this one where they say, hey, you shouldn't be avoiding most of these food additives? What's your big takeaway from this section?
So for this one, the big one that you've kind of seen if you follow health and wellness in the news at all is food dyes. As we know that, one of the big things with, the over the summer or the late fall, we kind of saw some people go up to the Kellogg's Corporation and
Right.
and do a march up there over the food dyes in their cereals. Apparently, there's a genetic marker that showed up on these updated tests just about 6 months ago. And it can show you whether your body is going to have a larger problem or not so bad of a problem with some of these food dyes. And again, nobody that I know is paying attention to whether or not the dye in their cereal is causing their problems or not. They're
Right.
just associating it with something else or just how they feel on a regular basis is normal.
Yeah, and there's so many people we get who go to Europe or go some other place, and the certain foods they eat here that make them feel terrible. They'll go there and eat and have no problems. And that's, I think, when you get down to a lot of the things that are in the food. It's not always if you actually the actual ingredients you need to make these foods fresh, oftentimes are not necessarily the problem. It's all of the junk that we put into the food itself. There's actually a program that I think it's the CDC. It's one of the government organizations. Pretty sure it's the CDC, but it's looking at toxins in our environment. So they track this stuff actually. They don't do anything about it, but
Yes.
they track it. And I'll never forget this. It was several years ago, probably 5, 6 years ago, that a new chemical came into the mix that they were tracking that they were seeing in the environment in people quite often. And they had a little section in there where they talked about what this compound is kind of like structurally, and this one happened to be kind of a plastic type chemical. And then they talked about where they find it the most, and it was number one was breads. And I'm
Breads.
like, what? How is that happening? And so that just tells you, literally there's plastics in your bread with these really processed foods, and this explains a lot why we're having people who are having issues that they normally wouldn't.
That's funny you should mention that. I was rewatching an episode of, Joe Rogan's podcast, whether you like that or not, but it was the Casey Means and Callie Means episode.
Sure.
And one of the stats that they put in that podcast was that since we've invented plastic as a population worldwide, there have been 8 billion metric tons of plastic produced. And all these new studies where they're testing plastics in different organs of the body, they found microplastics in every organ. And there's 2 recent studies that showed that when they looked at men's testicles, 100% had microplastics in
Right.
them. And then they did one with fetuses, and 100% of fetuses had microplastics in them. Plastic water bottles is one of the biggest contributors to how plastic gets into our body.
Yeah,
But
I'm
there's
sure
plenty of
that
other ways
has
it
no
does as well.
correlation with decreasing testosterone levels. I'm sure that has no correlation with decreased levels of fertility in general, neurodevelopmental disorders going through the roof. I'm sure that has no connection, right?
It absolutely does, because I want to say that the microplastics can create aromatase in the body, which converts testosterone to estrogen. So what happens because of that is that, young girls are hitting puberty way earlier because of that, 6 years earlier on average than 100 years ago.
Okay, let's move on to as we this kind of segues well, toxic exposure. So we're I think we're already laid the foundation that we're all exposed to this stuff, right?
Yeah.
There's no avoiding it to some extent. Obviously eating organic, doing certain things to limit the exposure is definitely possible. But even with that, the exposure is going to affect more people than others, and some of that has to down to their genetics.
Yeah, this section is one of my favorites in the genetic report, because literally you can do something about this, but I don't think anybody would ever know. I think I've known one person in my life. There was some lady at my church when I was growing up who could not handle smells. Like
Right.
anything that had a scent to it would cause her to, have a reaction. I don't remember what the reaction was. I mean, this was 30 plus years ago, but I do remember specifically. But what these markers are: aromatic hydrocarbons, insecticide sensitivity, so, glyphosate, and then phthalates and parabens, and beauty products, conditioners and shampoos and things like that. And then, of course, BPA's and plastics, which we just kind of mentioned a second ago, iron sensitivity, and even acetaminophen, which is what Tylenol is. And a lot of people don't really know that, if your liver can't process acetaminophen, you can cause some serious damage with it.
Right. And I think this, helps us kind of go down the path of, what is most important to avoid and, where you protect yourself. And then you can also, customize some things to, because some of the reason people have these sensitivities to this is one, they don't detox efficiently. So they're not going to, so if you thought about, your liver's ability to detox junk in your environment as like a bucket, and some people are going to have a bucket like this. That might be, let's say that's the normal bucket. And some people
Mhm.
might have a bucket like this. Okay. And when that's the case, you need a lot more support to those phase one and phase two detoxification pathways. And so even when, let's say we get a patient who's trying to lose weight, your fat is where you store a lot of those toxins. And so we really need to support people in those areas to be able to not have kind of, to some extent, collateral damage or make them not feel like crap in the meantime while they're losing that weight. So I think this is probably one of the more valuable sections myself.
It really is, because I've dealt with, approximately 75 clients over the course of the last year or so. And I don't follow I don't follow my clients around, obviously, but you get a sense of who's working it and who, kind of is taking it moderately, and then you've got some people that don't take it seriously at all. But you get a good idea of who's really doing the work. And not all results are the same. Not to say that it's an excuse, but some people do have to work a little harder because they don't detox quite as well as others. It's a
Right.
huge factor.
Right. All right, let's move on to oxidative stress, which, going back to what I talked about inflammation as being a result of essentially metabolic dysfunction, this is the actual physical reaction that's happening. And this can come down to either lack of antioxidants, lack of our strongest antioxidant, which is glutathione. This can also happen, coming back, this can actually combine with the other factors that we saw as well. So, like if you're not detoxing properly, then you're going to eat up all of your glutathione and you're going to have oxidative stress because your body can't deal with the routine oxidative stress you got every day. Okay. I mean, even when you exercise, you're going to have oxidative stress to some extent. That's normal. You're breaking down
Acutely.
muscle fibers to build new ones. Inflammation is normal in the body. Inflammation is abnormal when it isn't resolved. That's really the big thing. So when you get sick, you get inflamed.
Hmm.
Oxidative stress happens, but it's the body's ability to then control that inflammation and resolve it. That's what's really important. So these markers will come into, hey, do we need to give you more selenium to help you produce enough glutathione? Do we need to support with specific pathways within that antioxidant production, because just because you're getting antioxidants, you got to metabolize them and utilize them. And so I think this is a really good way that, hey, we can have oxidative stress due to all of these other weaknesses and just our poor environment and poor food supply. But how do we also augment the results of that? Because, if we got to, let's say we go back to that last section and we have a sensitivity to glyphosate, which is Roundup, right? It's everywhere. I mean, it's kind of
Illegal in
depressing
most
when you
other
look
countries
up.
in the world.
Yeah, when you look up the amount of glyphosate that's in the environment and you test or even organic foods for it, you're going to find it because of like runoff and different factors. It's just in less amounts. But if that's something that's really problematic for you, then we're going to have do some things to help reduce the oxidative stress as well. All right, nutrient deficiencies. This is one that is probably becoming the most popular, I would say. I feel like there's probably a chunk of the people watching this who know what things like MTHFR are, even though I think that's in a section going forward and probably jumping the gun there a little bit. But that's the one that causes, some more of the significant, more common nutrient deficiency we see. But there are actually markers that show that you may not process, especially a synthetic vitamin. I don't think people realize this. There's lots of synthetic vitamins that we make as humans. B12 is probably the best example of that, in folic acid. Cobalamin, which is the synthetic B12, and folic acid do not exist in nature. They don't exist in food. It's something that we made up as humans that is chemically similar, that in the right circumstances you can break down and utilize as a vitamin. The problem is, with certain genetic mutations, instead of making that a two-step process like it would be in food, it might be a 10-step process. And so you might get 30% of that vitamin that you took in, or you might inflame your body trying to do something with it when it really can't.
Right.
And so I'm sure you see this quite often. Vitamin D is probably one that we see all the time. So, you know, how does this impact your coaching?
Okay, so it does. So a lot of times when people are looking for, say, a multivitamin, or it doesn't even have to be anything specific, but a grocery store branded vitamin that's the cheapest one you can get is likely going to be all of the cheapest, most synthetic, and least bioavailable forms of these nutrients. So when you read the back of the label, it might say 100% vitamin D, 100% vitamin A, 100% vitamin B12. But if your body doesn't have the ability to produce or convert these to the usable forms, because
Right.
nothing that we eat or ingest leaves our body in the same form or gets used in the same form that we ingested. It has to be converted to something else. And if your body can't do that because there's a 10-step process to get to where we need to go, you might only be getting 20% of what the label says that actually gets used in your body. So we know that methylation is something that has to happen. And like you were saying, the MTHFR, that's one of the more commonly known. So speaking of folate, folate is what is in food, for example. Folic acid is a man-made synthetic chemical, does not occur anywhere in nature. And a lot of people can't use that. So, for example, the example report that I'm looking at right now says, for you're homozygous for the C677T variant, which results in a 60 to 70% reduction in MTHFR enzyme activity. So you could be eating or you could take a supplement with 100% of the folic acid that you need and not be getting anywhere near enough for your body to function optimally. And that goes with other vitamins as well. It has a test for, or it has a genetic marker for vitamin A, vitamin D, E, phosphatidylcholine, which is another one that's very important. Eat your eggs, people.
That's actually important to how your cells operate. I mean,
Yeah.
that is really goes into the actual lining of your cell membrane and how that uses nutrients, how that's going to operate. So that one's actually extremely underrated. Good for
And,
your,
and, and
important for your
another
brain and
something we
organs.
do, then obviously you know this, Dr. Zaideman, but what I love to do is take one of these genetic reports and compare it alongside to blood work. And it often paints a picture that for my, like you asked me, how does that affect my coaching recommendations? So not every body needs to be on 1,000 different supplements.
Right.
Most of what we need is a multivitamin and then targeted supplementation after that. And it really helps us narrow that down so you're not spending an arm and a leg on guessing what you may need.
Right. And you actually talking about the blood work, this is a perfect time to do it because when we talk about MTHFR and methylation without getting into like, a whole weekend seminar here. I mean, it is probably one of the most important cycles in cellular health. And we can actually you can have this mutation and you supplement properly, you eat properly, you do the lifestyle things, and you're not going to have any issues from it. Okay. And then there's people, and it's going to depend on the level of the mutations. There's different levels to all of this stuff. What actual genetic sequence we're seeing mutated, that's all going to impact this. But there's actually a blood test that you can measure to see if you're having inflammation from this. So even if you don't know if you have MTHFR or not, you can run a test called homocysteine and see if there's inflammation resulting of that. So, homocysteine is essentially an inflammatory marker. It's a natural compound in our body that's made through the methylation process. But these B vitamins in the methylation cycle actually help break that compound down. So, if it's not being broken down because there's dysfunction in the methylation, which can happen for other reasons too, not just this genetic mutation itself, but then we will know that you're actually being inflamed from it. So it's really important to know these things are here, but it's also even more important to when it comes down to how we're actually going to deal with it is what are you doing now? What is your current situation impact? How is it impacted at this current time before we or even do anything? Is this a major source of your inflammation? It may not be, but there are ways to kind of see how this plays out in reality, not just in theory. Okay, so we've talked about a lot of the B vitamins, nutrient deficiencies there. This is probably something that people are going to be interested in coming into hormone function and how we're processing this hormone. So everything from thyroid hormone processing to different downstream hormones, whether it be testosterone, estrogens, and that can be really important, especially for men and women especially if you are estrogen dominant, getting all of these estrogens that's in our food supplies and from the plastics and these other things that end up with these excess estrogens. This is a lot of estrogen sensitive tissue in the breast and cervix that can actually lead to cancers that are really important to know about. And there are ways to help kind of detoxify or help process. There's natural compounds that will help you process those estrogens that can limit that risk. And then also things like thyroid. One thing that I know is super frustrating when I treat people who have thyroid symptoms is they'll oftentimes get like a TSH test, which is, basically a hormone coming from your brain that is supposed to line up with how much hormones you have in your body. The issue is that communication between the body and the brain is not always there. And so we'll see people who have this normal TSH, they have normal T4, which is the T4 is a hormone that your thyroid's actually producing, but they're not converting T4 to a compound called T3. Guess what your cells use? Your cells use
Great.
T3. So that's kind of important. And so if you have a genetic weakness, and that's one of the things that we see here is this conversion of T4, T3, then we may know that someone may come back, they're on medication, they're got a normal TSH, but they still feel like their thyroid's slow because they don't have T3. And so this is another thing that it's important to know, is this a potential weakness, but also now it triggers us even more that, hey, we need to make sure we run T3 in the blood as well. So really cool how we can also tell people, hey, whether or not is, bioidentical hormone replacement a good idea for you? If you don't metabolize estrogens real well, that might not be a real good idea. So this is also an area that can give us a lot of useful information and how we can augment their overall health to even help hormones, which is really cool. All right, this might be. I got a feeling Thomas is into this section. Let's go into the neurological section here. Dopamine, different neurotransmitters processing. Um, Thomas, what do you usually get from this section?
Well, I love this section because it generally tells me, not generally, but it sometimes tells me, how a person's mood might be, or not on a, an hour to hour basis, but
Sure.
in general, how does this person, what is their personality going to be like? How are they going to react to certain things? And it's really neat because everybody knows somebody in their life who's just a dopamine chaser, whether that expresses itself in, risky type behavior. They like, dangerous things, or, on the more unfortunate side, drug addiction and things like that. The COMT, I'm going to read this because I will get it wrong if I don't, but the COMT gene encodes an enzyme responsible for breaking down dopamine, epinephrine, and norepinephrine. COMT variants affect the enzyme's activity, influencing neurotransmitter levels, and impacting mood, cognition, pain tolerance, and stress resilience. So you can even kind of predict whether somebody might have a tendency towards ADHD or, other things like that.
Right. And I think this is where genetics come into play into neurodevelopmental disorders. I mean, whether it's autism or now with autism, there are actually genetic disorders where, as a result of that genetic disorder, they will fit autism symptoms. But ADHD and autism in general, as a general rule, are not genetic disorders. They are influenced by genetics for sure. And I think this is an example of how they can be with environment and a whole variety of different factors. But another important thing I like to talk about when it comes down to neurotransmitters is that sometimes these cancel out. So you might have a genetic mutation where you don't make dopamine very efficiently, right? And it comes in your brain slower. And so if you just look at that, then your first instinct is, oh man, I need to crank my dopamine up, right? But if you have this COMT, when he talks about how we break them down, right? If you also are, not breaking down your neurotransmitters effectively, then it's going to kind of cancel out because, yeah, you might be producing them slower, but they stay in your brain longer. And so if you go and a person like that crank up their dopamine, or same thing with like serotonin, then you can make that person worse. And I think that plays into why we see people who are put on antidepressants and it makes them more suicidal, right?
Right. I mean,
And so I
SSRIs.
I think this is an important thing. If you're dealing with mental health, that's a whole nother podcast going into SSRIs and those types of medications. But even if that's something you're considering, doing genetic testing, I think is very important because some of the consequences of some of those medications when you're fooling with neurotransmitters, because frankly, there's not a good way to measure neurotransmitters in any test. There's urine tests, there's different tests that people will utilize, but their real life application have not proven to be super helpful, at least in my experience. So looking at the genetics, I think is super helpful, and also knowing where their weakness, from our perspective, knowing about um, how you coach a certain patient. You know what I mean? You might see, okay, this person's going to be harder to keep on task. They're going to be harder to keep this routine, or this is going to, food might be a little bit more emotional for them, and it can really augment how we help coach you into getting into. It's one thing for us. Anybody can tell you what to do, but being able to tell you what to do specific to your body and in a way that is going to be practically successful for you, because I can tell person A, hey, let's go cold turkey on this, and that's going to work perfect with their brain, right? That can tell that same thing to another person, and they might have a full meltdown over it because of how much it overwhelms them. And so knowing this can actually help us even get better results just from the psychological perspective. All right, so let's go into just prevention and optimal health. I think this is a super interesting section looking at these risk factors that can lead into things that nobody wants to even think about dealing with, Alzheimer's, dementia. But I don't think we should run from it because there are some things that you may not like the solutions to them, but it can really help you motivate to know, hey, we really got to take this a little more seriously. So, I mean, especially when you get that grandmother, or you said, hey, every grandparent on my mom's side has had Alzheimer's, and you feel like you're just doomed with it. This actually gives you some things you can do to possibly avoid that.
Yeah, so this test has a genetic marker called the APOE. And what that means is we get one E Okay, so that's what we're looking at. Yeah, E's 1 through 5. You get one E from each of your parents. The completely normal risk would be a double E3. Both parents give you an E3. That is about what 70% of the American population is. But if you do have a more rare type, which would be like an E4, E4, there's studies that show that if you are a double E4, you have a very, very high likelihood of showing some sort of Alzheimer's symptoms by the age of 65. Now, the sooner you learn this information, the sooner you can take the steps to prevent that from happening. And you need to do that early because if you're already showing symptoms, it's probably a little late. You need to do that midlife or before. So knowing these things can help prevent something tragic down the road for sure.
Yeah, I think that probably worth the test right there is just knowing those things that we can try to, that's a problem when it's, a lot of these things sometimes once you become really symptomatic, there's things you can do, but, we've kind of started to miss the boat already. So,
Yeah. And the good thing about this too is with this test, it doesn't just say, hey, you got this. It gives you recommendation protocols on how to make some changes or add some different things into your life to help this, the risk go down for sure.
yeah, and that's what we're here for, to go along that journey with you and customize everything from your supplementation, because I mean, there's a lot of different things that can help for these different areas. But you don't necessarily need to take. I mean, I'm looking even for the E4 supplementation recommendations. They're throwing a kitchen sink because there could be all kind of different factors. But between combining with blood work and then also looking at these other genetic markers, we can really that might be two supplements we're doing to prevent some of these things. So it can really be customized down to that kind of level. All right. Well, that is the full genetic profile test that we run. As you can see, a wealth of information that go through this. I do want to remind everybody through the end of January, we are including this test as part of our functional medicine evaluation. So this is something you can take advantage of. Feel free to call our office at 850-877-6790 or just visit our website at healthytallahassee.com. And just to lead you guys up to the rest of the year, we're going to be doing this on a regular basis. Thomas will be here sometimes. We might have some other guests. You might be stuck with just me sometimes, but we're going to be trying to dive into have these conversations about these kind of chronic health issues and different topics. So, feel free to leave us a comment of some topics you might want to hear about. We would love to have your input and put that into the workflow of things we can talk about, and then offer you some solutions on how we can go about it. One thing that we've seen over the last few years is that a lot of this chronic health issues aren't being dealt with the traditional medical model, and it takes a more holistic, functional perspective to balance out the whole body here. So we look forward to sharing more information with you in the future. Thanks for joining us. Please subscribe to our YouTube channel and you'll get notifications on new episodes. And we look forward to making this the healthiest year of your life.